Hello, dear all, namaste. In this video, I shall be discussing about the biologic treatment of nasal polyps. So this is the treatment that uses monoclonal antibodies to target specific inflammatory pathways, especially interleukin 4, 5, 13 or IgE in patients with severe chronic rhinosinusitis with nasal polyps who have not responded to standard treatment like internal corticosteroids. As you know, steroids are the best treatment modalities for nasal polyps, also called as medical polypectomy. But steroids may have side effects, especially oral steroids may have side effects. To avoid that, we can use monoclonal antibodies, which are made by a single clone and act against a single inflammatory pathway, like interleukins. The indications for biologic treatment are for severe cases where patients experience frequent recurrence of polyps after surgery, or when the patient require frequent course of oral steroids, which may have side effects. When the patient is in other comorbid conditions like asthma, then we can use biologic treatment. Around 40% of patients with allergic rhinitis may develop asthma in their lifetime. When the patient have history of type 2 inflammation, that is induced by high eosinophil counts and significantly impaired quality of life, then we can use biologic treatment as the specific criteria. What is the basic mechanism of action of biologics? They target the underlying type 2 inflammatory cells that cause nasal polyps, T helper cells type 2. They are administered as subcutaneous injections, usually every 2 to 4 weeks. The approved biologics for chronic rhinosinusitis with nasal polyps are dupilumab, omalizumab, and mepolizumab. Although there are new medicines being used. The question is, how do they differ from traditional medicines like steroids and antihistaminics? Because they are designed to block specific proteins in the inflammatory pathway. They are cytokines, especially interleukins. The dupilumab targets interleukin 4 receptor alpha, which reduces the inflammation and mucus production. Therefore, it is superior to other drugs. Omalizumab targets IgE. As we know, IgE is involved in allergic response. High eosinophilic load in the nasal mucosa leads to sneezing, itching, watery rhinorrhea, and sometimes yellowish nasal discharge. Mepolizumab targets interleukin 5, which drives the production of eosinophils. Therefore, both omalizumab and mepolizumab they act against eosinophils. New medicines, tezepelumab blocks the thymic stromal lymphoprotein, which is alarm that starts the inflammatory cascade. Therefore, tezepelumab may be a better choice in the future. Is biologic treatment safe? Does it have side effects? Generally, biologic therapy is safe with a tolerable side effect profile, but sometimes mild reactions like headache or injection site irritation may occur. But other side effects are less common than oral steroids because they target the specific pathways rather than broadly suppressing the immune system. Therefore, biologic therapy is better than steroids. But only problem with the biologic treatment is they are costly. So we have to reserve this therapy for patients who meet specific criteria. One should remember that biologic treatment is not the cure. It's important to note that biologics are maintenance therapy. So once we stop them, they may lead to return of symptoms. Thank you very much. Please subscribe my channel Dr. Krishna Koirala for more videos like this.